Well, howdy YouTube family. It's Bold CRNA coming to you again with another day's topic. Today we're going to talk about what ICU that you should work in to get into CRNA school. A lot of people have opinions on this. A lot of people will try and say it's a certain ICU unit versus another unit. That's going to be your guaranteed ticket in, or it's going to give you the edge in the interview for CRNA school to get in versus another student. So I'm going to tell you what my perspective and what I viewed as being the truth about this while I was in CRNA school and helping interview other students trying to get into CRNA school. Let's get into it. First things first, let's clear the air. One thing that a lot of students try and say, and I guess it's just some rumor that's being propagated out there, they believe that the CV-ICU unit is the golden ticket. That's the unit that means you're going to get into CRNA school. That's the unit that means that you're destined for anesthesia. That's not true. I haven't seen that anywhere. I have not seen any professors tell me that. I have never seen any program directors tell me that. I have never talked to CRNA students, which I've networked and talked to hundreds and hundreds and hundreds of them, and I didn't get the feeling from any of them or the message from any of them that they were all CV-ICU nurses. That's not true. So let's just mute that and understand it. Now that we've cleared the air on that false notion, let's talk about what you actually need to do in the ICU and which ICU is best for you to get into CRNA school. So the best ICU is going to be, drum roll, any ICU that you can get into. Oh man, I kind of tricked it, didn't I? It's any ICU that you can get into, with a caveat, that has high acuity patients. Now there are some ICU units out there that are considered ICU in a small critical access hospital that are 4 beds and they don't take anything. They might have like 1 vented patient per day, and that vented patient is supposed to be stable on maybe 1 pressor max, and if anything else is going on they ship them out to another hospital. That's not what I'm talking about. You should know that's not what I'm talking about, because obviously you're not going to learn very good critical thinking skills. You're not going to get very good challenges. You're not going to get to see a lot of pharmacology or titrate a lot of drips or use a lot of technology and equipment or network with other different healthcare professionals on a multidisciplinary team to take care of the patient. You're not going to really do that much on a small little hospital like that with a couple beds. That's not a good ICU. That would be the only ICU that I would tell you is a bad ICU, and you've messed up by choosing that ICU to try and go to CRNA school. That would be the ICU that you'd be sitting in the interview with them, and they would be asking you about your ICU experience. They would ask you questions like how many beds and how many drips do they usually have and the types of patients that you take care of. And when they realize you worked in that kind of unit, they may think twice about taking you into their program. Because honestly, that is a glorified step-down unit. And there's nothing wrong with that. And there's amazing nurses who work in those units. But that's not the kind of unit that you need to work in to become a CRNA. That's the wrong kind of training. So, with that said, all these other units, you want to work in a medical ICU unit that's got 15 beds, go do it. If they've got vents going on and multiple drips happening, and you're doing intra-aortic balloon pumps on some patients, and you're doing continual renal replacement therapy on other patients, and you're doing hypothermia protocols on acute MIs or brain injury patients and some basic stuff like that. If you're doing those things, you're recovering DKA patients in acute crisis phase and stuff, you're getting good experience. You're using those muscles, those critical thinking skills that they're looking for you to become a CRNA. There is nothing specific about one certain ICU unit that makes you a CRNA, because honestly, as a CRNA, you will take care of all patients. You will take care from a neonate, a little baby who needs anesthesia, all the way up to a 103-year-old centurion who broke their hip, and you will take care of everything in between that. You will take care of the pregnant mother in there somewhere. You're going to take care of the 55-year-old MI'd father who, had some kind of MI at work. You're going to take care of the 21-year-old girl with gallbladder disease and who's going to have a cholecystectomy. You're going to take care of everyone. So don't think because you work in a neuro ICU and dealt with a lot of neuro patients that's going to give you this inherent edge above the other students coming in. Or if you work in a CV ICU unit and you've dealt with a lot of open heart surgeries, that doesn't mean that that means you're probably going to be pretty good at cardiovascular when you get to that chapter in the book, but that doesn't mean you're going to be any better than any of the other students who are coming in when you're talking about the other 90% of anesthesia that's not the cardiovascular system. Just understand that one unit does not make you any better than the other, but it also means that you have to apply yourself. Whatever unit you go to, if you work in the CVICU, you gotta expand your horizons, because if you're dealing with open heart patients all day, there's a lot of other types of pathophys and a lot of other types of patients you're not gonna see, that you're not going to deal with on a normal basis, and those will be patients you will see and deal with when you're a CRNA, because like I told you, the CRNA takes care of everything. You're going to be dealing with renal failure patients, you're going to be dealing with COPD patients, you're going to be dealing with neuro patients, you're going to be dealing with cardiovascular condition patients, you're going to be dealing with patients with pancreatic cancer needing a Whipple, you're going to be dealing with a lot of that kind of stuff. And chances are, if you're in the CVICU, you're not getting a lot of those different various broad spectrum patients. You're getting a lot of cardiovascular patients over and over and over again. So you're probably good at those cardiovascular patients, but not the others. And I honestly feel like a medical/surgical ICU, which is what I did all the units, honestly, over time. I worked in CV neuro ICU, I did neurosurgical ICU, I did medical ICU, I did cardiac ICU, I did a little bit of pulmonary ICU. I didn't do pediatrics and burn. Those are the two ICUs that I never worked in. But as a travel nurse, I worked in 8 different ICUs over time. And so I got experience with a lot of different types of stuff. And I gotta say, that's probably your best bet. Getting really diverse experience that gives you that ability to think not just about the heart, not just about the lungs, not just about the brain, but about all the systems, all the pathophysics going on there, and the different types of various medications. Because I'll tell you, sometimes I could float from the CV ICU over to the pulmonary ICU, and some of the medications they were using over there were completely different from me, that were controlling pulmonary hypertension and stuff. Those were meds that I had never seen in the other units that I worked in, and they were very tightly, titrated and micro drips and stuff. Those are meds that I was very unfamiliar with, so it expanded my horizons on the different types of pharm that we were using and the different pathophys going on with those patients. So I'm just saying, the more diverse experience that you can have in the ICUs, the better. My last tip about working in the ICU is, when you're there, study the drips that you're using. Understand the mechanisms of action of those medications. Understand some of the adverse events of those medications. Understand when you should wean them off those meds, when there's other meds that would be safer for them to be on. Say you're using dopamine for some reason for hypotension. You chose dopamine. Understand why you chose dopamine. Why are we not using norepinephrine? Why are we not using vasopressin? What other meds could we be using? Why are we using dopamine? Is it the best option? And understand that reasoning. You might uncover that maybe it's not the best option. Maybe you talk to the provider and say, hey, they're continuing around 105 sinus tach with this dopamine. Maybe we should use something else instead. My point is, you'll see a lot of stuff going on in ICU if you pay attention, and if you're doing your research and knowing your pharm and knowing the current recommendations of the different meds you should be using, that's going to give you that edge. So when you do start CRNA school, you're going to be very familiar with already thinking like that, because that's the way you have to think as a CRNA. All right, guys, that was my little speech about which ICU you should work in to become a good CRNA or to get into CRNA school. I give this answer out to so many people on Instagram. Of course, you can go follow me over there. It's Bolt CRNA on Instagram. I try and interact with everybody over there. And a lot of people DM me that question over and over and over again. Over the last few years, I've got it so many times. So I'm putting out this video here so now I can reference it and I can say, hey, go check out this video, because for 10 minutes I gave a full explanation on the reasonings behind my ideas and why I think this certain way. If you think differently, you can sound off in the comments below. Of course, I'm all up for discourse on this topic and other people's opinions. I'm not always 100% right, so we can always talk about what you think about this. But remember, hit that like button, hit that subscribe button, follow me on Instagram, and that's Bolt out.